Anyway, how are you? Good afternoon to everybody. Um, I would like to welcome all of you to this first of a series of um, training sessions. Without further ado, let's jump into it. No, gagawin na natin. So, this is one of my favorite topics about coronavirus. So let me go ahead and jump into it first. No, okay. First of all, I'd like to tell you that the past 2, 3 years talagang nayanig ang buong mundo, no? By this coronavirus. And from sabi nila from Wuhan, no? This virus causing severe acute respiratory syndrome, SARS-CoV-2, no? Virus did not only affect us in our country, but it affected us globally. Not only did it affect us economically, kasi nagsara lahat, no, ng mga economies and financial institutions because everybody didn't want to work, no, because of the scare of getting COVID, no. And not only financially, but including our health system, it was overwhelmed because of this coronavirus. Not in so many, wala pa ako alam na isang particular disease that has done so much, no, damage to us than COVID, no. Of course, in the past, yung sinasabi nila Spanish flu, etc., no, nangyari yun. But this one is more kasi mas marami ang apektado, mas malaki na ang population natin, no. Now, so Margaret Keenan is the first individual, the first person who was vaccinated by our no less Filipina nurse, the first one by vaccinated Pfizer BioNTech vaccination. Now, vaccines, as they have been saying all along, ang vaccine is the only weapon that we have at the moment, no, na talagang tried and tested na panlaban natin sa COVID, no. But a lot of questions arise. How the efficacy and the safety of vaccine. Efficacy, bakit po? Because ang dami nating vaccine na in the market nung tayo maliliit pa. For example, polio vaccine given to us, and yet it covers us for the whole year, di ba? Lifetime na yon ang coverage. Yung iba nating mga vaccines, when they were young, once lang. Like ito, no, smallpox, etc., polio. And then others naman, yearly, no? Even the flu vaccine, the regular one is yearly. Yung iba, twice lang, lifetime nila, no? Measles, rubiola, etc., no? But, as you notice, COVID, nakita nyo naman, no? Mayroon ng first dose, may second dose pa, mayroon pang first booster, second, third, may fourth pa ngayon, no? So, again, the question arises, ito ba effective talaga? Bakit napaka-short-lived ng effect niya? Ba't napaka-ikli, no? Safety, ang dami nagque-question ng vaccines. Bakit? Maraming namamatay, maraming nagkakaroon ng complications and they cannot answer this, no? You will have to remember, ang vaccines are only EUA, ano? Emergency use authorization lang yan, no? Because it has not passed through the third, no? Review nila, tests to validate its safety. That's the reason why it has to be guaranteed by government. So again, the safety of the vaccines. Marami nagke-question, no? Especially among young, male young patients na binabaksin, nagkakaroon ng mga cardiomyositis, no? Heart cardiomyopathy, I'm sorry. No. Now, let's go first to what is the COVID, the virus itself. It looks like this, no? In illustration, the COVID coronavirus structure has a lot of mga spikes. Actually, the spikes around the virus is the S. These are proteins, no? The S, the spike protein, the EV, okay, protein, the membrane protein. It is so unique for coronavirus COVID these spikes around its body. That is very unique for it. That's the reason that it was named corona. No? This is like a crown. No? Sorry. So itong EV proteins niya will be the ones that will be very, very much, and sorry, the spike proteins will be the ones that will be very much in, we will be dealing in the coming slides. No? So basically, we have here how it goes, paano siya na pumapasok sa atin, no? How we get infected, no? Comes in and then goes to the lungs. And then the lungs, pinakadulo ng lungs natin, we have our the basic unit, the alveolus. Alveolus, or the plural, marami, alveoli, no, sa dulo. The oxygen exchange happens between this, the lungs and the blood, no? Ito na yung bloodstream, no? Umiikot doon sa dulo ng alveoli. So pagka pumasok na ang COVID inside, it will affect specifically the lungs. Of course, there are other areas of the body which I will mention, no, where the viral particles go, no. And of course, this is the schematic diagram. What happens later on, no? It produces parang in disguise, hindi siya nahuhuli ng ating immune system, hindi agad na-detect, and it drops and sinks into our system, specifically the spike proteins, and goes inside, drops its RNA, replicates a single strand, and produces a lot, na-duplicate siya tremendously, nagmo-multiply siya, and it goes out, and ang dami niyang inflammatory cells that are producing the cytokine storm, and it affects almost all organs, no, specifically the ones that are very basic, that we need for survival, no. So basically, the viral particles can be found in different areas. Among them, of course, the nasal passages, kasi doon dumadaan, and the throat, no, tears, stools, the kidneys, liver, pancreas, sa puso, no, even the cerebrospinal fluid, or CSF, no. The reason why we even found mga pediatric patients na nagkaroon ng lumbar tap sa likod at kinuha na ng water sa brain, at nakita it was the baby was infected with tawag nito COVID now. Basically, as you can see here, you will the specific involvement of the virus when it comes in, aside from the lungs, it affects other areas. So these are the extra pulmonary, or outside of the lungs, the brain, no. You can have headache, dizziness, no, nawawala ang panlasa mo, no, pang-amoy, anosmia, ataxia, no, nanginginig ang paglakad nyo, and then it affects the heart, okay. Cardiac troponins, ito yung mga enzymes na nire-release ng heart, na makikita through laboratory tests. And also, it can affect the kidneys, kaya tumataas yung ating creatinine, ang urea, proteins go up. Our liver, it affects our liver, no? And therefore, liver enzymes also are noticed to increase. It affects the intestinal, our gastrointestinal tract. That's why we also have nausea, vomiting, diarrhea, okay? You also have diarrhea. And then, specifically, ito na napaka-importante, and I would like to repeat this, we will be dealing with this very in detail, the blood, yung dugo, no? The ProTime elevates, D-dimer, tandaan nyo ito kasi itong mga nire-request ng mga doctors, no? Fibrinogen, all of them are elevated, no? Tumataas. Anong ibig sabihin nun? Clotting, nagka-clot ang dugo natin, no? The ferritin values, ito na, no? C, reactive protein, ESR, lahat ito tumataas, no? And all because of direct viral infection. Diretso, no? The virus affects, nag-multiply na siya, as I mentioned earlier kanina, and it affects by direct infection to these particular organs, no? Okay, our next slide. So the organs that have ACE2 receptors are the ones that are targeted by COVID. ACE2 or the angiotensin. Hello, can you hear me? Anyway, um, the angiotensin enzyme 2 receptors are the favorite of the COVID virus. These ACE2 receptors, napakadami sa heart, sa kidneys, sa brain, liver, and blood vessels. So therefore, ito ang inaatake nila. Why? Because they attach to these ACE2 receptors. Hindi sa iba, pero dito. And these are the basic organs that we have for survival. Dito sila kumakapit, no? And because of these receptors, no? And as you can see in this diagram, no? When the virus enters our lungs, no? Doon siya sa dulo, the ACE2 receptors attached to the epithelial cells in dulo, to the alveoli, nandun sa dulo, no? And it releases this particular event is, well, manifested by the production of PAF. Later on, I'll go into that, no? At this time, you develop mild to moderate symptoms, no? Ito yung fever, cough, muscle pains, slight difficulty of breathing, okay? And so basically, as I was saying, you have mild to moderate symptoms, no? And when you have a lot of viral load, ang nasagip nyo, marami, the high volume of virus, if you have comorbidities, senior citizens, etc., no? You can have a tremendous production of the virus, nagre-replicate, marami, and then it will produce a lot of pro-inflammatory enzymes. So you will have inflammation. So you will have production also of blood clots. Napaka-importante po nito. Excessive inflammation and the cytokine storm. Ang cytokine storm na ito, itong dalawa, excessive produces pro-inflammation, no? Doon sa baga natin, sa lahat, no? Kidneys, as I was mentioning earlier, no? This will produce critical symptoms. Ito na yung severe, no? It will produce DIC or disseminated intravascular coagulation. Kakaroon na tayo ng mga blood clotting all over our body, multi-organ damage, etc., no? So dyan na ho nangyayari yan. Now, as I was mentioning earlier, when the virus jumps inside the lungs, it will attach, the spike proteins will attach. Ito yung pinaka-importanting nangyayari, no? The platelet activating factor, no? Is developed. Platelet activating factor is acetylglyceryl ester phosphorylcholine, no? Ano ba yun? Well, basically, ang simply saying, PAF is the key. Ito yung susi ng virus, okay? COVID virus. To produce, one, inflammation, because it will give you a lot of pro-inflammatory enzymes. Dadami inflammation, magmamaga ang iyong baga, and therefore it leading to the cytokine storm and blood clotting. Ito yon, platelet activating factor, PAF. Napaka-importante po. Platelet. Teka muna, Doc, parang naalala ko yan sa dengue. Correct. When you have dengue, bumabaga ba ang iyong platelet, di ba? Kaya you have platelet transfusion. Bakit bumababa? Affected ng virus, no? Ng ating dengue virus. What happens is, you need to bumababa ang platelet. So, ang nangyayari, pagka walang platelet, ang ating dugo, malabnaw, no? It will not clot. Kanya, dugo ka ng dugo. Pag nasugatan ka, whatever happens, no? Hindi siya magka-clot. So, you bleed to death. Kaya panay ang transfuse, wala ka ng platelet. Kaya ang ibibigay sa iyo platelet. Platelets will thicken your blood to prevent it from hemorrhaging, no? Pagdugo ka ng dugo, that's why it's called hemorrhagic fever, H fever, okay? So, basically, ito yung kabaliktaran. So, you produce platelet activating factor. Ano nangyayari? It will activate your platelet, PAF. Ano mangyayari? Magkakaroon ka na ngayon ng clots. Imbis na malusaw, clotting ang problema mo ngayon, no? So, this is the problem. Why clotting? Why, doc? Why is it very important? Well, basically, clotting is very important in COVID virus kasi it attacks, the clots will attack directly the organs, no? The virus attacks the organs with receptors, ACE2 receptors, no? And it indirectly attacking the organs, collateral damage you will produce, as I mentioned earlier, cytokine storm. Indirectly, it will cause damage to the organs, and it means blood clots, no? Indirectly. Indirectly, it will cause damage, and as a result of low oxygen level. Pinagbabara na yung lungs nyo, hindi na ganun ka laki ng butas. So exchange of air, gas, blood transfusion, gas exchange is diminished. So hirap na siya huminga, no? So bumababa ang SpO2. Kaya during the time na yung ating IATF parating, monitor your oxygen level. Pag bumababa below 90, you go to the hospital already, etc., etc. So, now, these two would describe what I was saying earlier, no? These two illustrations on my left and on the right, no? As you can see here, itong first picture, illustration here, shows dito sa taas, no? Ito yung healthy na clear na airways ng lungs, no? Daanan ng hangin. Dito sa baba, ito yung sumikip na, lumiit na yung butas. So, counting oxygen na lang ang pumapasok doon, no? At carbon dioxide na lumalabas, no? But this is the picture of a mild, okay, form of COVID, no? Dito, medyo efficient pa ang labas ng hangin at yung carbon dioxide exchange, no? Ang ating alveolus or the basic unit of our lungs can still function to the gas exchange between our lungs and the bloodstream. And once the blood is able to accept more oxygen, and it is pumped to the heart, right side of the heart, and then back to the left and pumped out para i-supply doon sa ating basic organs. Okay? So, as you can see here, on the right side, this is now what we call the severe or moderate to severe COVID. What happens here is you have cytokine storm, as you can see here, ruptured na, and you can see dito sa kabila, buo pa yung iyong alveolus, pero dito ang lungs nasira na, no? Damage na ang dulo, and as you can see, yung dulo niya are very much destroyed, and therefore it cannot function exchange of gas anymore. Wala na, no? So, and the dulo niya, as you can see here below, the lungs have been infiltrated, yung dulo niya, by the virus, and therefore hindi na siya makaka-function. This is now an emergency. You now have difficulty breathing. There is less oxygen coming inside going to our organs, and you now have a case of an acute respiratory distress syndrome, which may lead to death. Okay, so basically this is what happens, no? Ito na yung alveolus, pinalaki natin, no, yung dulo. So you can see here ang exchange ng oxygen, carbon dioxide, hindi na ganung, there is impaired gas exchange kasi damaged na yung dulo. Okay? And since there is mataas ang production, PAF, as I mentioned earlier, okay? Platelet activating factor, ina-activate. So, anong magkakaroon kayo ng blood clots? So, you have clots already here outside of the lungs, okay? And hindi na makadaan ang hangin, nababara na ng clots natin, okay? So, ito ang nagiging sanhi ng less oxygen going to the body. So, pag tinest mo sa pulse oximeter natin, mababa ang oxygen mo because clots are developing outside. Okay? So, now, of course, this is severe already, no, moderate to severe, and you have the cytokine storm. So going now to clots, I am saying this is so important because dito sa next slide natin, you will see that in the States, they have noticed, in CNN, pathologists, doctors. This was what, July 10, as you can see, mid-July 10, this was the peak, They were noticing blood clots in almost every organ during autopsies. Pag ino-autopsy nila ang mga namatay sa COVID, they noticed blood clots. So bakit may ordinaryong flu, wala namang ganun ng mga clots, no? So now they were correlating everything. What the autopsies are teaching us about coronavirus, they're saying. So basically, when they noticed this, they concentrated on how do we treat patients. So ang daming namamatay, they could not understand. Kung nahihirapan huminga, you know what was happening. They used high flow, High flow kung tawagin nila. But it is high flow, you increase the flow of oxygen, pinipilit, pinipuwersa kasi hindi na nga makahinga ang oxygen, dinadala sa ICU. Para pumasok ang oxygen, So the autopsy of COVID-19 patients revealed blood clotting in the organs throughout the body, hindi lang sa lungs, So basically ito na 'yon, So ito ang mga nakita nila, You can see blood clots, as you can see that, Ito yung lungs mo, you see? Paano ka makakahinga niyan? There are clots inside your blood. Paano nangyari 'yon? Kung tubig nga lang 'di ba? Nalunod tayo, you gasp for air and you die because of suffocation. Ito mismo doon sa loob, Kahit talagyan mo ng tubo dito sa labas, pagpasok ng hangin, there is no more exchange kasi sa loob barado na ng clots. Okay? So this is the real picture of what was happening to COVID patients, the lungs. So you can see here the lungs sa dulo ng pulmonary, primary bronchus, sa dulo niya are the alveoli, yung basic unit. What is saddening is just beside the alveoli are, nakikita niyo ito. What are these? These are your capillaries. Capillaries are the smallest blood vessels. Blood vessels which has ACE2 receptors. Paborito ng mga COVID. Kanya dyan sila nag-i-stick they go there, attack the blood vessels because it has ACE2 receptors, and the more ang bilis ng replication ng COVID. Nakadikit dyan So wala kang magawa but expel out, spread out the virus all over the body and then to basic organs. And you see here, this is the lung, and they autopsied it and you notice blood clots all over, as you can see that, paano ka makakahinga, and even in this areas you can see ito ang kulay ng lungs, but you can see here parang mga hematoma, may mga pasa ang baga, These are real patients of COVID lungs, of COVID patients, So makikita nyo doon na dami. Now, blood clots were being thrown all over. Pupunta sa brain, ayan na, confused, nagkakaroon ng mga seizures, ang pasyente, stroke sa utak, So may stroke. Ano ba ito? Stroke, hypertension. So hindi na nila alam, Yung pala COVID, So COVID was presenting in so many ways. Hindi mahuli-huli ng mga doktor, Pupunta sa heart, magkakaroon ng irregular rhythm, Nagkakaroon ng heart attack. Wala naman, normal naman ito. Athlete niya athletic, Wala siyang mga bisyo and all. But yet, inatake sa puso, They're surprised. Kidneys, pumupunta doon yung mga clots. That's why you had patients dinadialyze. Bakit ganon, you ask, bakit, Doc? COVID lang naman yan. Influenza, parang flu lang yan, di ba? Bakit dinadialysis? Because the levels of creatinine nag-i-elevate, hindi makalabas ng dumi ang kanyang kidneys. So tumataas ang creatinine, Just like when you are diabetic. So nagtataka tayo kung bakit. Well, obviously, nabara ng blood clots ang kanyang kidneys. So this was what was happening during the time. Nagkakaroon ng, at this time, madali nang to look back, Pero marami nang nangamatay, a lot of mortalities, no? But doctors were learning at this time kung ano ba ang nangyayari. And this was the problem, no, of COVID, no? Even doon sa paa, parang may diabetes, no? Ang diabetes, kumakapal ang ating mga ugat doon sa paa, kaya wala nang dumadaloy na dugo. There is no more blood circulation pag nasugatan ang paa. Then, hindi naghihilom. Why? Because there is no blood circulating to keep it healthy. The same thing as COVID. And it will the blood clot will go to the vessels in on your lower extremities and then block it, and therefore you cannot anymore have a good supply to your feet. And ito ang nangyayari. This is a COVID patient. This patient was amputated, by the way. Okay? Pinutol yung kanyang paa because wala na yan eh. Hindi na magagamit because patay na yung. Eh ano naman yan, Doc? Paano naman tayo? How can elixir placenta? Paano pipicture dito sa COVID, no? Obviously, eto na, pasok ang bida. What in elixir placenta? What ingredient can help COVID patients? Obviously, I can name one very specific example of one very specific active ingredient of elixir placenta, and that is olive leaves, no? Ole or olive leaves extract, no? Olive leaves extract has oleuropein, no? It has hydroxytyrosol, and it has muscarinic acid, no? And napakaganda po nito because it has antiviral, specifically anti-SARS-CoV-2. It has anti-thrombotic activity. You know, I mentioned earlier, thrombus ay yung clots. Thrombus clots yun, no? May ganitong function ang ole, no? And of course, anti-inflammatory, no? Nagmaga na yung mga tubo ng baga natin, inflamed na, and then hindi na makadaan. Pag nagmaga, hindi na makadaan ng hangin or blood, no? Doon sa mga kidneys natin magana. So it has anti-inflammatory activity. How nice, di ba? Kompleto siya. Now, let's go into specifics. There have been experiments, no, proven that this particular active elements that you find in olive extract has the following properties, no? It has hydroxytyrosol, no, which is virucidal, no? Pinapatay ang virus, especially against the COVID-2, no, through the structural changes, which changes, it disrupts the viral genome, no? Viral activities din, no, itong olive leaf is shown when it decreases luteolin, which is also against the SARS-CoV virus, and of course inhibition of the COVID virus multiplication. No? Ito pa, I'm going into more details. They made a spray of hydroxytyrosol, and it has proven against COVID, no, infection. 50 volunteers in their experiment, it showed decrease in viral load, no, and cure in 6 patients within 10 days. Okay, this is research that was done in 2020, no, and it has ethanolic extract. Again, the olive leaves extract exhibited anti-inflammatory activities, no, properties, and it has analgesic or it addresses pain, analgesia, no, and the level of which is similar to indomethacin, which we use to treat even mga pains, no, muscle pains, bone joint pains. It has antipyretic, anti-inflammatory. Ito na naman, no, which I have been saying earlier. It helps, especially dito sa ating cytokine storm, no. We need anti-inflammatories and anti-thrombocytics. Now, oleuropein, okay? Oleuropein has been known, okay, to have antiviral properties, no, anti-inflammatory as well properties, and it is virucidal. And this particular, well, it has been proven, it has experiments, as I mentioned earlier, may mga studies to show that, no? Hydroxytyrosol, again, it destroys pro-inflammatory markers. So it promotes anti-inflammatory properties, no? Which we need when we have COVID infection, no? um, then, ito po yung basic na apat na mga elements that we find terpenoids. Terpenoids we find as one basic element of olive leaf extract. And under terpenoids, you have oleanolic acid, you have ursolic acid, muscarinic, I mentioned earlier, and oval. All of them are anti-allergic and anti-inflammatories, no? Makakatulong when you have especially severe, moderate to severe COVID, no? And as well as may mucolytic activity siya, no? Now, going to immunomodulatory, no? Effect, activities of the olive leaf, no? This is manifested by hydroxytyrosol and muscarinic acid, no? It inhibits, once you have this, it has been shown to inhibit the cytokine storm, which overwhelms our immune system. Pagka nagka-cytokine storm ka na, magdasal na ang pasyente because kung malakas ang immune system mo, you could get over it. Pero pag mahina and you have a comorbidity, diabetes, hypertension, and other problems, you may die because of this, no? And it is a good treatment for cough and asthma because it is a mucolytic, no? It lyses the mucus na nakadikit doon sa ating mga pulmonary bronchus, no? Sa ating baga, no? Let me mention that the anti-thrombotic activity of muscarinic acid also, okay, ito na tayo, sorry. Anti-thrombotic activity of ethanolic, hydroxytyrosol, and muscarinic acid is also recognized as indeed a very good property of this particular active ingredient of ELIXIR placenta that helps decrease platelet aggregation. Ano yung platelet aggregation? Nagdidikit-dikit to yung platelet. So, it forms clots, nagbubuo-buo. It decreases it, no? Nawawala yun, no? Nalulusaw, no? So, it prolongs prothrombin time, no? It prevents associated intravascular coagulation. Napiprevent niya yung pag-coagulate, yung pag-clot ng dugo. So, ang laking bagay po nito, no? So, moving on, now we say that after all what I have mentioned, napakaganda ng ole, no? Olive leaf extract. It is very rich in secondary metabolites, which are antiviral. It has anti-inflammatory, anti-fever, pain, immunomodulatory. It modulates our immune system. Yan ho pang ibig sabihin. Yan. Anti-thrombotic, anti-clots, no? Mga clotting, ha? Kinalabanan yan. And then it has a potential to control cytokine storm. Nako, napakaganda. And which is seen in moderate to severe COVID, no? So, and other complications. Also, ang ole or olive leaf extract has antiviral activity that has been described to benefit, no? It benefits which includes its biosafety, its availability, low cost, no? Kung ano-ano mga mahal na mga remdesivir ang mamahal po nun. O tocilizumab, which is what, 6,000 per, ito ang mura. So it leaves this natural remedy to be given a chance, to give it more experiments to develop this into a more potent anti-COVID treatment, no? Hindi lang isinasama sa mga supplements, but kailangan buo talaga as pure, no, form. So, yun lang ba ang makikita natin sa ELIXIR placenta? Of course not, no? Our main actor dito, of course, sinasabi natin, co-starring itong ole, no? Olive leaf extract. But the main actor here is, of course, what is our main ingredient in elixir placenta? Of course, obviously, it's the deer placenta, which contains, obviously, stem cells. And how does stem cells combat coronavirus? There have been experiments to show that, for example, this particular research showed that a 65-year-old woman was given, nasa ICU na siya, was given stem cells. And on the third day, the patient started to improve. And the same treatment protocol was given to 7 patients, and all of them improved, recovered from COVID, no? Courtesy of the stem cell that was given to them, no? Nawala yung kanilang fever, nawala ang shortness of kanilang paghihinga, nahirapan sila huminga, and decreased oxygen saturation, wala din yon. Of course, pneumonia. And all of this decrease in the next 2 to 4 days, no? Ito, nakita ito. And even the lung findings were shown by CAT scanning, no? Makikita doon that the degree of pneumonia had diminished tremendously because of stem cells, no? Now, ang stem cells, how do they act, no? In COVID, they are powerful immunomodulatory, and ito yon, anti-inflammatory. Pabalik-balik tayo, anti-inflammatory property of stem cells. The anti-inflammatory effect of stem cells has long been recognized. That's the reason why for the past years, stem cells have been used to treat rheumatoid arthritis, ulcerative colitis. Approved na ito ng FDA, no? All over the world. Multiple sclerosis, kung tawagin, MS, no? And others who have transplanted organs, yung mga kidney transplant and other organs, ginagamit na po ito, no? So, basically, this is what happens, no? In an illustration, you can see here, pagka nagka-COVID, no? And pag ito yung kanyang status, makikita ninyo, when given stem cells, the stem cells has the effect of immunomodulation, as I mentioned earlier. Maliban doon, it is antimicrobial. So, ang napaka-importanting effect ng stem cells for COVID is ang virus goes to the lungs. I mentioned you earlier, no? Kinakain niya, no? Sinisira yung tissue ng lungs. So damage na po 'yon. Hindi na madadaanan ng hangin 'yon, no? So hindi na madadaanan ng hangin, there develops fibrosis. Fibers 'yon. Fibers, ano ibig sabihin ng fibers? Parang scar, no? Peklat. Kaya nga pagka in-x-ray tayo, sasabihin mahina ang baga nyo, ay matagal na ito dahil mayroon na pong peklat ang baga nyo. This is it, no? Magkakaroon ko ng scarring or fibrosis. Stem cells will bubuhayin niya nung scars na yan, no? It has, as you can see here, anti-scarring effects to avoid fibrosis in the lungs. Babalik siya, magiging healthy ulit, no? It reverses it. So napakaganda ho ng stem cells that can be used, no? So ito siya, no? When COVID goes in, ito, okay, obviously the stem cells has the following functions. It has antiviral, okay, property. It repairs cells, no, cellular repair, and then also tissue regeneration. Lahat ng organs na nasira ng virus, ng clots, no, will be repaired by stem cells, no, and immunomodulation, no. Ito yung sinasabi ko, iniiba yung iyong ini-improve or tawag nito, binuboost ang ating immune system, no. Okay. Specifically, it is very good for itong mga diseases which of course refers to the lungs, chronic obstructive pulmonary disease, okay, yung acute respiratory distress syndrome and the like, no. Basically, in summary, dito natin makikita that stem cells, which ELIXIR placenta is most, sabihin na natin kilala siya doon, has these properties, no? Since the COVID virus has destroyed the alveolus, no, alveolar capillary membrane, nagkaroon ng lung fibrosis, tumigas na, no, nagkaroon ng scarring, nagkaroon ng inflammation, okay? Ang stem cells will repair, regenerate, babalik ulit, no? It is anti-inflammation. So, yung maga, pag nagmaga ang ating mga tubo, mawawala yun. So, makakadaan ulit ang ugat, and anti-fibrosis. Ganda, no? It addresses almost all the basic problems. So basically, stem cells treat the lung injury. It repair and repair that is caused by the virus. Multipotent differentiation. Ibig sabihin na multipotent, maraming areas na i-repair niya. The heart tissue na sinira, cardiac muscles, aayusin niya. Kidney muscles, aayusin niya. Multipotent, potential, na maraming potential, no? Na it can develop lungs, aayusin niya. It produces a variety of cytokines and growth factors, no? It differentiates. It differentiates means, ang ibig sabihin niya, tutubo siya ng ganon, no? Tutubo siya ng alveoli, epithelial cells, kasi nasira yon, no? Ng lung cells, no? Ng endothelial cells sa mga sa mga ugat natin, no? Blood vessels, no? So lahat yan, it promotes injury repair, ang bottom line, no? Repair to damaged tissues, na hindi nagagawa yan ng kahit anong gamot. Only stem cells do that, no? Repairs of injury that has been suffered by our organs. It promotes angiogenesis. Ano bang angiogenesis? Mga blood vessels yan na nasira, no? Angiogenesis refers to recovery or regeneration, bumabalik yung mga ugat natin, and promotes repair of the kidneys and intestines. Ayaw nyo ba noon? Napakaganda, no? It addresses all of this, no? That has been caused by COVID, no? Ay, nako. Ang dami na, no? So, we're almost at the end. So, basically, yun na yun. Now, but wait, there's more. To surprise you, actually, just look at the list of the active ingredients of ELIXIR placenta. You will see a lot of this. The other active ingredients of ELIXIR placenta. Look at that, no? Basically, I can name immediately right there. You have rhodiola, which stimulates our immune system. Pinalalakas niya, no? To recovery and to counter a COVID virus. Grapeseed extract, which reduces blood clotting, you know, and anti-inflammatory properties. MCT, medium chain triglycerides, has anti-inflammatory action, no, properties. Ay, nako, paborito ni Gerson, red ginseng, no? Anti-inflammatory effects. Esqualene, it's an immune system booster, no? Pampalakas para hindi na mag-proceed tayo from mild, para na hindi maging moderate to severe, no? Ang sea buckthorn oil, no? It supports wound healing, 'di ba? Sabi ko, nasira, na damage yung ating lungs, yung kidneys. It reduces scarring, no? Ano mag-scar, fibrosis, yung ating mga baga, no? Nawawala yan, nababawasan. Immune system booster, anti-inflammatory, it fights infection. And the last one, black cumin seed oil, it improves lung function, di ba? Especially COPD, no? Chronic obstructive pulmonary disease. Nako, napakarami. Isa pa lang ito, COVID pa lang po ito. So, ladies and gentlemen, no, ating mga GFAX believers, I hope you learned a lot from this afternoon's session, a lot about secrets and mga benefits, properties of ELIXIR placenta na akalain natin na wala lang, ito lang, no? No, napakadami po niyan. And hopefully, we can go and sa mga susunod na sessions, we will be discovering more. Specifically, we will be going specific diseases para mas maintindihan natin. Ito ngayon, COVID ang ating tinakel, no? And I hope you learned some Well, sabihin na sa dami niyo ng natutunan, mas magagaling pa kayo kaysa sa akin sa COVID, no? I'm just trying to refresh, add a little more to what you know. Thank you so much. Maraming salamat po.